Last time we started the two-part series on hot flushes and night sweats in menopausal black women. These are the two of the most common symptoms that any woman would experience going through menopause. Please make sure you check out the first video if you've not seen it yet, because many women do experience these symptoms together. In that video, we looked at 6 common questions around hot flushes to understand how they happen and some ways that you can treat them. Today, we answer questions about night sweats. Hi and welcome. I'm Dr. Sylvia, a general practitioner and health educator with AskAwayHealth, giving you lessons on video about your health and helping you to live better. Please subscribe to my channel and click the notification bell so that you know every time we publish a new video once a week. Now, let's talk about night sweat. Number 1, what causes night sweats at menopause? Why does anyone wake up at night drenched with sweat? Well, those are night sweats, and they can happen thanks to the dropping and fluctuating levels of the hormone estrogen around the time of menopause. The estrogen changes prevent the areas in your brain that regulate your temperature from working properly. These in turn make your blood vessels open wider, allowing your temperature to go up and making you sweat. Night sweats can also happen during pregnancy and after you've had your baby, when the estrogen levels are also fluctuating. Other causes of night sweats include medical conditions, for example, some types of cancer, such as lymphoma. Lymphoma is a type of blood cancer which develops when some of the cells of your immune system, called lymphocytes, start to grow abnormally. Other medical conditions are bacterial infections, such as from tuberculosis, or an infection that affects the inner lining of the heart. You may also suffer from a condition known as hyperhidrosis. This is when your body makes excess sweat, but without a medical cause or being an effect of the environment around you. Having low blood sugar, an overactive thyroid, or even suffering from extreme stress or anxiety can also lead to experiencing night sweats. But there's still many other causes. They may happen as a result of side effects from depression treatment, hormone treatment, or even medications used to treat diabetes. People taking morphine-based painkillers may experience night sweats as a side effect, and night sweats can also happen after taking caffeine and alcohol or using tobacco. For some women, certain types of chemotherapy, that is cancer treatments, can affect their ovaries and lead to early menopause, which will happen with night sweats. Number 2, how to stop night sweats and their effects. The critical thing is to know what is causing your night sweat. They may be from reversible conditions like drug side effects or medical conditions that are treatable. Or it may require that you cut down on the quantity of caffeine or alcohol that you're taking. But here are some other measures. During the day, be sure to perform any exercises early on in order to avoid the risk of sweating at night. Next, be sure to take plenty of fluids during the daytime to replace any fluid that you may have lost from sweating at night. In particular, limit spicy foods, sugary drinks, alcohol, and caffeine many hours before bedtime. Avoid taking hot drinks before you sleep. When you go to bed, keep your bedroom cool with a fan, an open window, adjust your thermostat, or use an air conditioner. Finally, protect your sheets with a towel or mattress protector to prevent your bedding from getting drenched. Do I need a blood test if I'm getting hot flushes and night sweat? Many women feel that unless they've had a blood test, they can't tell if their symptoms are as a result of the menopause. In many conditions, a blood test can give you specific results and tell you what the problem is. For example, if it's an overactive thyroid or a problem with the liver. However, suppose you are within the age when we expect menopause to be happening. In that case, a blood test looking for menopause hormones doesn't help. This is because the levels will be irregular, going up and down so often. A single blood test will not be conclusive and we can't interpret it. And so most often, given a lady's age, the diagnosis is made based on the symptoms. However, suppose you're quite young, say in your early 30s, with menopausal symptoms like hot flushes. In that case, doing a blood test for the menopause hormones and getting an abnormal result may tell us what is happening, particularly in this instance when menopause is not expected to happen naturally at this age. Thank you for watching. These are some of the questions we get about night sweats around menopause, what causes them and how they can be treated. If you need advice around this topic, you can use our email service to get in touch. The link is at the bottom of the screen and I will place it in the description box as well. Next time, we're going to be talking about HRT. What is bioidentical HRT? When should you stop taking HRT? And what is the role of testosterone in menopause treatment? Well, if you've been wondering about any of those questions or anything else related to HRT, make sure you've subscribed to the channel, click the notification bell for new video alerts so that you know when that video comes live. And while you're waiting for that to happen, check out these two here, and I'll see you again soon.